Julie, of course, you're the head of brand communications
Yes.
at Maybelline in New York.
Yeah.
And Neil, you're the CEO of the WHO Foundation. And yeah, we really want to talk about the partnership that we just announced a couple of weeks back. And the first question would be to you, Julie. Could you tell us why mental health is so critical for Maybelline?
When we launched Brave together, it was about Maybelline putting its looking glass into destigmatizing anxiety and depression, really
absolutely.
making that conversation widespread and making people feel welcome to talking about it and really feel normal for experiencing anxiety or depression. But it's accelerated so fast that, now mental health is a bit of a buzzword, and we know that what we wanted to do is create impact. So we're veering a little bit away from destigmatizing and more into really adding value to our consumers. So that's why we're focusing on call lines, text lines, making sure that people have access to resources and doing the most tangible that we can so that people, have the tools that they need.
And the goal of our partnership is to make sure that 2 million more people have access to mental health services. And the way Julie was mentioning some of the NGOs that deliver incredible work on the ground, and Julie, speaking of living the values, Julie and her team visited many of these programs. I mean, traveled the world and saw for themselves how their resources are improving mental health services and met people who have benefited from that work. The WHO, the World Health Organization, the way that its work enables and empowers those types of organizations is really at the policy level. So whether it's making sure that at a national level, mental health services are included in the essential package of health services, it's training healthcare workers to provide mental health services, it's democratizes and decentralizing healthcare services so they're available at the community. You don't have to travel a great distance or go to a provider, a mental health provider, which often is hard to come by, but you can access some of those services locally. Those are the types of systemic improvements that the WHO is making possible, so you have those concrete outcomes that Julie is speaking about.
And the power of the community that it builds. These local NGOs are oftentimes, for example, in India, training like local members of the community to be able to deliver support. I think that kind of movement is super powerful, and that's why it's important for us to have a global partner that we can exchange with. We can understand where the mental health trajectory is going. We can understand which NGOs to partner with, so that we can empower our teams on the ground even more. The advice that I would give to another brand is find the cause that aligns with your values, that really speaks to your consumer, and live that cause both externally and internally, and something very powerful will come to life.
Just building off of what Julie said, if you have companies who want to live their values and who want to scale, the WHO is a great partner because the World Health Organization scales and accelerates solutions that improve health. And that can be across a wide range of areas. It can be mental health. It could also be the intersection of climate change and health. It can be in the context of natural emergencies, where there's an immediate need to respond to people's healthcare needs, whether it's in a conflict, where it's trauma, or whether it's after a flood, in which case you want to prevent diseases like cholera. The WHO works on non-communicable diseases like diabetes, on infectious diseases like malaria, and of course on gender equity and making sure that women and girls have access to healthcare just as much as anyone else on the planet.
Thank you both for all those insights. Really exciting time for the partnership, and I'm looking forward to having impact together.
Thanks.
Thank you.